Dr. Ann Peters, a leading American endocrinologist and one of the foremost experts in diabetes care, once said, "Managing diabetes isn't just about cutting sugar, it's about nourishing the body in the right way to help it heal, stabilize, and thrive." And when it comes to nourishing the body, vitamins play a far more critical role than most people realize, especially for seniors living with type 2 diabetes. If you're a senior struggling with blood sugar levels, fatigue, slow healing, or diabetic complications like nerve pain or eye problems, the issue might not just be your diet or exercise. It could also be a hidden vitamin deficiency. As we age, our bodies become less efficient at absorbing and utilizing nutrients. On top of that, diabetes medications and elevated blood glucose levels can further deplete essential vitamins from your system, leaving you vulnerable to more complications. In this video, we're going to uncover the top 6 essential vitamins every senior diabetic must consider adding to their daily routine, not only to lower blood sugar naturally, but to boost energy, protect vital organs, and slow down diabetic complications. We'll also talk about what foods these vitamins are found in, how much you may need, and who should be cautious with certain supplements. So if you're ready to take charge of your diabetes health, and you're tired of just treating symptoms instead of getting to the root cause, this is the video you need to watch from start to finish. Before we begin, make sure to like this video, subscribe to the channel, and click the bell icon so you never miss any of our senior health tips. And if you know someone who's diabetic, please share this video with them. It could truly change their life.
Number 1.
Vitamin D, the sunshine vitamin that balances blood sugar. Let's begin with one of the most researched and powerful nutrients for blood sugar control, vitamin D. Often called the sunshine vitamin, it plays a far bigger role than just keeping bones strong. In fact, low levels of vitamin D have been directly linked to higher insulin resistance and poor blood sugar regulation, especially in people over 60. Now, here's the shocking part. Over 70% of seniors are deficient in vitamin D, and that number climbs even higher in those with diabetes. Why? As we age, our skin loses the ability to synthesize vitamin D from sunlight, and many seniors also avoid sun exposure or take medications that interfere with absorption. But how exactly does vitamin D help diabetics? Well, this vitamin plays a key role in how your pancreas produces insulin and how effectively your cells respond to it. Low vitamin D levels may impair insulin release, making it harder to keep your blood sugar stable. Multiple studies have found that improving vitamin D levels can reduce fasting blood sugar, A1C levels, and even lower inflammation throughout the body. So, where can you get more of it? Natural sources include fatty fish like salmon and mackerel, egg yolks, and fortified dairy or plant milks. But in most cases, especially for seniors, a daily supplement of 1,000 to 2,000 IU may be recommended. Of course, always get your blood levels tested and consult your doctor before starting supplementation.
Number 2.
Vitamin B1 thiamine, the nerve protector and glucose regulator. Next up is vitamin B1, also known as thiamine, a lesser-known but incredibly vital nutrient for diabetics, especially seniors. Thiamine plays a central role in glucose metabolism, helping convert the sugar you eat into usable energy. But for diabetics, this vitamin is often lost through increased urination, making deficiency all too common. The real danger here? A lack of B1 can lead to diabetic neuropathy, the painful, burning or tingling sensation in the hands and feet that many seniors know all too well. Thiamine is critical for maintaining healthy nerves, and when levels drop, nerve damage progresses much faster. In one study, people with type 2 diabetes were found to have up to 76% lower levels of thiamine compared to healthy individuals. Even more promising, researchers discovered that supplementing with benfotiamine, a fat-soluble and highly absorbable form of B1, helped reduce symptoms of nerve damage and improve glucose tolerance. So how do you get more thiamine naturally? You'll find it in foods like sunflower seeds, lentils, whole grains, peas, and pork. However, for therapeutic benefits, especially for those with neuropathy, supplements might be necessary. A common dosage of benfotiamine is 150 to 300 milligrams per day, but again, consult your healthcare provider to find the right form and dose for your body. Don't underestimate the importance of this underrated vitamin. Boosting your B1 levels may not only help with energy and blood sugar, but may also help prevent or slow the progression of the most dreaded diabetic complications.
Number 3.
Vitamin B12, the memory and nerve function booster. Vitamin B12 is absolutely essential for seniors with diabetes, yet it's one of the most overlooked nutrients in diabetic care. This powerful B vitamin supports nerve health, red blood cell production, and even memory and mood regulation. But here's the catch. If you're over 60 and taking metformin, the most commonly prescribed diabetes medication, your risk of vitamin B12 deficiency skyrockets. Metformin, while effective in lowering blood sugar, can interfere with B12 absorption in the gut. Over time, this leads to a gradual depletion that can cause symptoms many seniors mistakenly blame on aging, such as fatigue, numbness or tingling in the hands and feet, muscle weakness, and even memory loss. Low B12 levels can make diabetic neuropathy worse or even trigger it in some cases. That's why more and more doctors are recommending routine B12 level checks for senior diabetics, especially those who've been on metformin for more than a year. To naturally boost your B12 levels, focus on animal-based foods like eggs, milk, yogurt, meat, fish, and fortified breakfast cereals. But in cases of deficiency, a daily supplement of 500 to 1,000 mg or even monthly B12 injections may be necessary, especially if absorption is impaired. A healthy level of B12 can do more than just prevent nerve damage. It can sharpen your memory, lift brain fog, boost your energy, and give you back that sense of vitality you might have been missing for years.
Number 4.
Vitamin C, the antioxidant that lowers fasting blood sugar. Vitamin C is well known for fighting colds. But did you know it also plays a crucial role in lowering blood sugar and protecting against diabetic complications? As an antioxidant, vitamin C fights off oxidative stress, which is a major factor in the progression of insulin resistance, blood vessel damage, and inflammation, all of which are common in diabetic seniors. Several studies have shown that taking adequate vitamin C can help reduce fasting blood glucose levels, lower A1C, and improve blood vessel function, especially in older adults. One clinical trial even found that patients who took 1,000 milligrams of vitamin C daily had significantly better blood sugar control than those who didn't. But that's not all. Vitamin C also helps prevent complications like retinopathy, kidney damage, and poor wound healing by strengthening blood vessels and supporting collagen production. For seniors, this means faster recovery, better skin health, and stronger immunity. Natural sources of vitamin C include oranges, guava, bell peppers, kiwi, broccoli, and strawberries. Eating these daily is a smart move, but supplements may still be beneficial if your diet lacks variety or if you're dealing with high blood sugar-related inflammation. However, always consult your doctor before taking high doses. Some people with kidney conditions or certain medications might need a tailored dosage. For most seniors, 500 to 1,000 milligrams per day is safe and effective. Vitamin C isn't just for cold season, it's a daily defender for your blood sugar, eyes, skin, and heart. And best of all, it's easy to add to your daily routine.
Number 5.
Vitamin E, the silent protector of your eyes and heart. Vitamin E is often called the silent protector, and for good reason. As a powerful fat-soluble antioxidant, it plays a critical role in shielding your body from the damaging effects of oxidative stress, which is especially harmful in people with diabetes. Over time, high blood sugar generates free radicals that damage your blood vessels, nerves, eyes, and internal organs. That's where vitamin E steps in. For seniors, vitamin E is especially valuable because it supports circulation, protects vision, and may reduce the risk of diabetic complications like retinopathy, heart disease, and even cognitive decline. In fact, some studies suggest that vitamin E can help improve insulin sensitivity, reduce inflammation, and support nerve health, especially when combined with other antioxidants like vitamin C. So where do you get it? The richest food sources include almonds, sunflower seeds, spinach, avocados, hazelnuts, and plant-based oils like sunflower or wheat germ oil. However, because vitamin E is stored in fat tissue, it's important not to over-supplement. The recommended dosage for seniors is typically 15 milligrams, 22.5 IU per day. But some diabetic individuals may benefit from slightly higher doses, up to 200 IU daily, under medical supervision. Keep in mind, too much vitamin E, especially over 400 IU per day, may interfere with blood clotting or interact with medications like blood thinners, so always consult your doctor before starting a supplement. Bottom line. Vitamin E doesn't just help your skin glow, it helps your heart beat strong, your eyes stay sharp, and your nerves stay healthy as you age with diabetes.
Number 6.
Vitamin K2, the bone and heart defender, in diabetic seniors. Last but certainly not least, let's talk about vitamin K2, a nutrient that is finally getting the attention it deserves, especially for diabetic seniors. While most people know about vitamin K1, which helps with blood clotting, vitamin K2 is different. It's a powerhouse for your bones, arteries, and insulin sensitivity. One of the lesser-known dangers of diabetes is that it increases arterial calcification. In simple terms, calcium deposits start to build up inside your blood vessels, raising your risk for heart attacks and strokes. Vitamin K2 helps redirect calcium out of the arteries and into your bones, where it belongs. This makes it a vital nutrient for protecting both your heart and your skeletal system. Emerging research also shows that vitamin K2 may improve insulin sensitivity and reduce inflammation, making it a natural ally in blood sugar regulation. Some studies have even shown that people who consume more K2 have a lower risk of developing type 2 diabetes in the first place. You can find vitamin K2 in fermented foods like natto, a Japanese soybean dish, as well as hard cheeses, egg yolks, butter from grass-fed cows, and liver. Unfortunately, K2 is hard to get in large amounts from diet alone, especially for those who avoid fatty animal products. Supplementation of MK7 form of K2 at 90 to 120 micrograms per day is generally considered safe and effective for seniors. However, people on blood-thinning medications like warfarin should be cautious, as vitamin K can affect clotting factors. In short, vitamin K2 acts like traffic control for your calcium, ensuring it strengthens your bones and doesn't clog your arteries. A simple, smart move for anyone managing diabetes later in life.
So there you have it, seniors.
The top 6 essential vitamins every diabetic should know about. Vitamin D, vitamin B1, vitamin B12, vitamin C, vitamin E, and vitamin K2. Each of these nutrients plays a powerful role in helping you manage your blood sugar, reduce diabetic complications, and support the health of your heart, nerves, eyes, and bones. But here's the key takeaway: no vitamin is a magic pill. These nutrients work best when combined with a healthy lifestyle, balanced meals, regular checkups, and staying active. Also, remember that not all supplements are created equal, and your specific needs may vary based on your medications, lab results, and overall health. That's why it's so important to talk to your healthcare provider before starting any new supplement. A simple blood test can reveal deficiencies and guide you toward the right plan. If you found this video helpful, please give it a thumbs up, leave a comment with your questions or experiences, and share it with someone you care about. And don't forget to subscribe to our channel and hit the notification bell so you never miss our weekly senior health tips. Stay healthy, stay informed, and we'll see you in the next video.